What a great day to talk about pharma. This is Clyde and today we'll talk about opium and morphine, only here in Vet Pharma 311. Let's go! Opium is a type of narcotic analgesic and is a dried crude exudate obtained from the unripe seed capsules of the poppy plant. The pharmacologically active principles of opium are alkaloids divided into phenanthrene and benzyl isoquinoline groups. Morphine is a full opioid agonist which can bind to mu, kappa, delta, and sigma receptors. The mu receptors give morphine euphoria effect and are associated with most of the analgesic effects of opioids and some undesirable effects. The kappa receptors contribute to spinal analgesia, sedation, and dysphoria, while the delta receptors contribute to analgesia and some peripheral effects like reduced GI motility. On the other hand, sigma receptors are not activated by morphine but is activated by other opioids and non-opioids, producing hallucinations and dysphoria. Here are some of the pharmacological effects of morphine to specific organs of the body. That's all for now. I hope you learned something in this video. Pharmacia!